Okay, so the question is, how do you use math regularly as a nurse, and why is it important in your job?
Hello. As a nurse, I use math throughout the day when administering medication. The math used to safely calculate doses involves the metric system and conversion factors. And a conversion factor would be 1 kilogram equals 2.2 pounds, or 1 gram equals 1,000 milligrams, or a kilogram equals 1,000 grams. Those are examples that are used commonly throughout the day. So you have to be able to read an order, to look at what medication you have on hand, and to know how much to safely give. Now, it could be as simple as a drug here that I have on hand is called metformin, and each tablet is 500 milligrams. So if the patient's dose was 1,000 milligrams, you would know that he would need to get 2 tabs, and then he would be receiving his 1,000 milligram dose. It could be something that simple, or it could be something where you have to uh, convert kilograms to pounds with an order such as giving a child with severe poison ivy 5 milligrams of Benadryl for every kilogram that he weighs each day, every 6 hours. And what you have on hand is 12.5 milligrams per 5 milliliters of Benadryl. What dose should be given? You have to be able to calculate that, and the fastest way to do that is using a ratio, which is really nothing but simple fractions and multiplication. And also, if you are going to be hanging an IV drip, you need to be able to calibrate a machine, a pump, so that the correct dose is given according to how many drips are programmed in. So as a nurse, it's very important that you don't just think you're doing the right thing. You have to know you're doing the right thing, and you can't make an error with these math calculations. Otherwise, you could severely harm someone, and you really do have people's lives in your hands. And you have to know what you're doing is right. It can't be almost right or pretty right. It has to be right.